Hi, my name is Alexis Alexandri. I'm currently a part of the Family Nurse Practitioner MSN program here at FIU. I'll be graduating with class of 2026. I got my Bachelor's of Science in Nursing from the University of Central Florida. I'm also a part of UCF Alumni and UCF Black Alumni chapter as well. I currently am working. I'm working per diem on a critical care floor here in South Florida. I'm actually from Miami, born and raised, and then I moved to Orlando to pursue my bachelor's, and now I'm back in Miami. So I work local at Memorial Regional Hospital, and in 5 years, I would have graduated with my FNP and already been board certified. I plan on working outpatient. I would like to work in a clinic. I'm not sure yet if I want to work with pediatrics or adults, but with clinicals, I'll see which age range I would want to work in, or if I want to work throughout the whole lifespan. So I don't have much experience in the OR, but with the experience that I do have, there are biases that I see towards the elderly. And mostly it will come from staff, whether it be nurses, doctors, or other staff that are working with the patient. Sometimes you can look at a patient and assume that they're not fully alert and oriented just based on their age, because they seem to be a bit elderly. People can assume that they're not fully alert and oriented. A staff member can come in the room and speak directly to family when the patient is right there and able to answer all questions and have opinions about their care. I've definitely seen that. I've seen to where staff will speak to the patient, and I understand you do have to do your assessment and you have to gauge if the patient is alert and oriented. That's for anyone. But once they are, sometimes staff will still talk, very slowly, or just talk in a way where they're treating the patient as if they don't really understand what's going on. And sometimes if the patient is fully alert and oriented, they do. And that is something that can be a bit offensive to anybody, treating them that way just based on their age. And that affects delivering quality care, because we want to make sure that we're providing the patient with the type of care that is most important to them. We don't want our biases to affect how we're treating them. So we want to value their opinion and not diminish their opinion because we think that they don't understand what's going on just because of their age. So that can definitely leave the patient with a negative impression of healthcare, and it doesn't allow us to give the patient the full scope and just give them the type of care that they would like while they're in the hospital.